Hello, and thank you for joining us in the Direct Care Aide Competency Education and Evaluation. Responsibilities. The responsibilities of the Direct Care Aide include provision of hands-on or cueing and supervision with ADLs and IADLs of a member in accordance with the individual's plan of care and that is necessary for the member's health and well-being, including but not limited to identifying when a crisis intervention is necessary. Monitoring and reporting any non-urgent or non-emergency changes in the member's medical condition to the nurse or the care manager. In cases of an emergency, report directly to the most appropriate provider and follow up with a member of the MDT. Providing ongoing supervision of health-related activities such as issuing reminders to the member about prescribed medications and timely refilling of the member's prescriptions, and completing a direct care aid log for each visit. Sending the completed direct care aid log at the end of each month to the nurse where it is maintained as part of the member's file. Notifying the provider of the need for alternative care for the member. Immediately notifying the provider when any of the following events occur: death of a member, a medical emergency, or a significant change in a member's health or level of functioning, a fire, accident, injury, or contraction of a serious communicable disease by the member or direct care aide, any planned or unexpected departure from the member's home by the member, and all other member or caregiver incidents or accidents. Policies and procedures. Each provider must develop, maintain, annually review, and update a comprehensive policy and procedures manual governing the delivery of services. This policy and procedure manual is located in the program director's office. The policy and procedure manual covers all areas of service and is driven by the Mass Health regulations found in 130 CMR 408. Mass Health regulations for services can be found at the website linked below. Delivery of services. Members requiring services must be under the care of a physician. The physician completes a health status report and a physical exam to confirm the member's medical condition. The physician approves the member's need for services. Members must need hands-on care or supervision and cueing in at least one ADL to qualify for services. The member will receive services under the care of the physician and will have monthly visits by the care manager and the nurse alternating months in the home. For more information on delivery of service, please refer to the Policy and Procedure Manual. Personal care assistance. Personal care assistance is defined as either hands-on, actually performing a personal care task for a person, or cueing so that the person performs the task by themselves in the performance of instrumental activities of daily living, or IADLs, and/or activities of daily living known as ADLs. As a direct care aide, the ADLs and IADLs you may be assisting with in the home include bathing, dressing, toileting, transferring, mobility, eating and meal prep, ordinary housework, laundry and linen changes, grocery shopping, and medication cueing. Providing safe personal care. Safety is important when providing care for both the member and staff. There are many ways we can keep ourselves and our members safe, including fall prevention techniques, hand hygiene and infection prevention, and good body mechanics. Fall prevention. Ways to assist in fall prevention in the home. Make sure pathways are free of clutter, boards, and other obstacles that may pose a tripping hazard. Make sure frequently used objects are within the member's reach. Make sure the member is wearing appropriate footwear. Make sure the assistive devices are in use. And make sure that transfers are safe. Infection control, hand hygiene. Staying home when you are ill is the first step in preventing the spread of infection and keeping members safe. Hand hygiene is the best technique in infection control. You should perform hand hygiene when before and after each member contact, before eating or preparing food, before setting up and assisting in a member's meal, after use of the restroom, before and after taking off and putting on gloves and other PPE, and after contact with bodily fluids and non-intact skin. How to perform hand hygiene effectively. Wet the hands under running water. Lather your hands by rubbing them together with the soap, and don't forget the back of your hands between your fingers and underneath your fingernails. Vigorously rub the hands together for a minimum of 20 seconds. Rinse your hands under running water and dry your hands with a clean disposable towel. Use a new dry paper towel to turn off the faucet and open any doors. Discard the used towel in a trash container. Vaccinations. Immunization is a global health and development success story, saving millions of lives every year. Vaccines reduce risks of getting a disease by working with your body's natural defenses to build protection. When you get a vaccine, your immune system responds. We now have vaccines to prevent more than 20 life-threatening diseases, helping people of all ages live longer, healthier lives. Immunization currently prevents 3.5 to 5 million deaths every year from diseases like diphtheria, tetanus, pertussis, influenza, and measles. Vaccinations continue to be effective in infection control prevention. Body mechanics. Body mechanics is a term used to describe the way we move as we go about our daily lives. It includes how we hold our bodies when we sit, stand, lift, carry, bend, and sleep. Having good body mechanics in healthcare will result in keeping you and your members safe. The basics of good body mechanics are maintaining a broad base of support, bending at the hips and knees and getting close to the person or object you are moving, using your strongest muscles, using your body weight to help push or pull, carrying heavy objects close to your body, avoid twisting of your body, avoid bending for long periods of time, and get help if the person or the object is too heavy for you to lift alone. Levels of functioning. Independent. The member performs 100% of the activity. They demonstrate proper safety techniques throughout the activity and do not require any type of assistance by a caregiver. They may require an assistive device or adaptive equipment or increased time. Setup and queuing. The helper sets up or cleans up, and the resident or member completes the activity. The helper assists only prior to or following the activity. Supervision. The helper provides verbal cues and/or touching assistance or contact guard assistance as the resident or member completes the activity. Assistance may be provided throughout standby assist the activity or intermittently. Minimum assist. Member performs up to 99% of the activity. The caregiver performs 1 to 25% of the task while physically guiding or assisting the member throughout parts of the task. Moderate assist. The member performs up to 50% of the activity, and the caregiver performs 26 to 75% of the task, assisting the resident through all or part of the activity. Maximum assistance is when the member performs only up to 25% of the activity. The caregiver is performing 75 to 99% of the task. One or more persons may be required to assist with the activity. Dependent. Member offers no physical assistance with the activity. The caregiver performs 100% of the task. One or more persons may be required to perform the activity. A total lift is required to assist the member in functioning. Documentation. As a direct care aide, you will complete a direct care aide log at each visit. This log will be sent into the office on a monthly basis and reviewed by either the care manager or the nurse and is maintained in the member's chart. Medication management. We do not administer medications to our members. As a direct care aide, you may issue reminders to the member about their prescribed medications and assist them in timely refilling of their prescriptions. The nurse keeps an up-to-date list of medications in the member's chart. Behavioral and mental health. There are 7 main categories for behavioral and mental health diagnoses: anxiety disorders, mood disorders, eating disorders, personality disorders, post-traumatic stress disorder, also known as PTSD, obsessive-compulsive disorder, psychotic disorders. Note, dementia is not considered a mental illness, although it does affect your mental health. Ways we can help those who have a mental or behavioral health diagnosis. We can remain calm and compassionate when speaking with our member. We acknowledge their concern or anxiety they may be having. Eye-level communication can help them feel more comfortable. Redirecting them to something positive. Recognizing changes in their signs and symptoms, and modifying their plan of care to best meet the patient's needs. We notify the PCP and community resources of change in patient behavior. We can assist them in medication management, the use of a lockbox, and education on med compliance. We can offer support to the caregiver and educate about the disease process for both the patient and the family. Dementia. Alzheimer's disease is a degenerative brain disease and the most common form of dementia. Dementia is not a specific disease, it's an overall term that describes a group of symptoms. 1 in 3 seniors dies with Alzheimer's or another type of dementia. It kills more than breast cancer and prostate cancer combined. Researchers believe there isn't a single cause of Alzheimer's disease. It likely develops from multiple factors such as genetics, lifestyle, and environment. Scientists have identified factors that increase your risk for Alzheimer's, while some risk factors such as age, family history, and hereditary can't be changed. Emerging evidence suggests there may be other factors that we can influence. Dementia is an umbrella term used to describe a range of symptoms associated with cognitive impairment. What are some of the most common symptoms of dementia? Memory loss that disrupts daily life, challenges in planning or solving problems, difficulty completing familiar tasks, confusions with time or place, trouble understanding visual images and special relationships, new problems with word finding and speaking or writing, misplacing things and losing the ability to retrace your steps, decreased or poor judgment, withdrawal from work or social activities, and changes in mood and personality. Steps for recognizing and responding to dementia behaviors. Detect and connect. Try and understand the patient's reality. Approach the patient calmly and respectfully. See the world through their eyes. What took place before the behaviors began? Try and decode what the dementia patient really needs. Always address physical needs first. Is the patient hungry, thirsty? Do they need to use the restroom? Are they comfortable or uncomfortable in their position? Are they in pain? Have they recently had a medication change? Always report findings to your PCP. Then you're going to address the emotional needs. Focus on the way the person's feeling. Do not correct the patient if they make an accurate statement. Use your knowledge of the patient to implement effective interventions. Redirect the patient into a more soothing activity or environment. And then reassess and plan for next time. Did your response help? Do you need to explore other options? Plan to reassess periodically for implementing effective interventions. Certain interventions for caregivers. You can redirect or change the surroundings and environment, provide food or a beverage, engage the patient in a soothing activity, comfort the patient, provide reassurance and companionship, reassess and plan for the next time, provide a structured daily routine, notify the physician of any unusual changes in behavior, and set up the home to be safe. Communication and interpersonal skills. Communication is a big part of the healthcare community. Practicing patience, responsibility, dependability, flexibility, teamwork, and authentic leadership make the workplace enjoyable and assist in giving our members the best care possible. It is important to remember communication is not only verbal, but nonverbal as well. Our body language and facial expressions are also a means of communication. Practicing empathy and active listening will help us to make our members feel well cared for. HIPAA, Health Insurance Portability and Accountability Act. Federal law that requires the creation of national standards to protect sensitive patient health information, also known as PHI, from being disclosed without the patient's consent or knowledge. It is our responsibility to keep all PHI safe and secure. PHI can fall under different categories such as names, geographic information, dates such as birth dates, admission dates, discharge dates, date of death, telephone numbers, fax numbers, email address, social security numbers, medical record numbers, health plan beneficiary numbers, account numbers, certificate and license numbers, and vehicle identifiers. Generally, a breach is an unpermitted use or disclosure under the privacy rule that compromises the security or the privacy of PHI. Your organization must notify authorities of most breaches without reasonable delay and no later than 60 days after discovering a breach. If you suspect a HIPAA breach, notify your manager right away. Abuse, neglect, mistreatment, and misappropriation. Preventing elder abuse and exploitation. Listen to older adults and their caregivers to understand their challenges and provide support. Report abuse or suspected abuse to local adult protective services or the police. You can use mass.gov to find your state's reporting numbers, government agencies, state laws, and other resources. Educate yourself and others about how to recognize and report elder abuse. Learn how the signs of elder abuse differ from the normal aging process. Check in on older adults who may have few friends and family members. Provide overburdened caregivers with support such as help from friends, family, or local relief care groups, adult daycare programs, counseling, outlets intended to promote emotional well-being. Encourage and assist persons, either caregivers or older adults, having problems with drug or alcohol abuse in getting the help they need. There's different types of abuse. There's physical abuse, when an elder experiences illness, pain, injury, functional impairment, distress, or death as a result of the intentional use of physical force, and includes acts such as hitting, kicking, pushing, slapping, and burning. There's sexual abuse, which involves force or unwanted sexual interaction of any kind with an older adult. Emotional and psychological abuse, referring to verbal or nonverbal behaviors that inflict anguish, mental pain, fear, or distress on an older adult. Neglect is the failure to meet an older adult's basic needs, which includes food, water, shelter, clothing, hygiene, and essential medical care. Financial abuse is the illegal, unauthorized, or improper use of an elder's money, benefits, belongings, property, or assets for the benefit of someone other than the older adult. Financial exploitation includes misusing an elder's resources for personal or monetary benefit, such as taking Social Security or SSI checks, abusing a joint checking account or credit card, or taking property or other resources. Elder abuse reports can be filed 24 hours a day, either online or by phone. If you suspect elder abuse, you must immediately report it to the program director. Elder Protective Services can only investigate cases of abuse where the person is age 60 and over and lives in the community. To report abuse of a person with a disability or they may be under the age of 60, call the Disabled Persons Protective Commission. Call 911 or local police if you have an emergency or life-threatening situation. Emergency preparedness. It's important to have information about local health, fire, safety, and building codes easily accessible in the event of an emergency. Have a plan for severe weather, including tornadoes, earthquakes, and floods. Since you do not know where you will be when an emergency occurs, prepare supplies for your home, work, and cars. Keep a kit in your home in a designated place and have it ready in case you have to leave your home quickly. Make sure all family members know where the kit is kept. Be prepared to shelter at work for at least 24 hours. Your work kit should include food, water, and other necessities like medicines, as well as comfortable walking shoes stored in a grab-and-go case. Have a kit in your car in case you are stranded. Keep a kit of emergency supplies. Emergency preparedness kits may include water, food, battery-powered or hand-crank radios, flashlights, first aid kits, extra batteries, whistles, dust masks, plastic sheeting and duct tape, moist towelettes, garbage bags, and plastic ties, wrench or pliers, manual can openers, local maps, and cell phones with charger and a backup battery. Fire safety. Workers should assess if there are fire extinguishers present in the home. Assess if there are smoke detectors at all levels of the home, and make sure the smoke detectors are maintained. Assess if there is more than one exit, plan for an exit, plan for a power failure, and plan for a natural disaster. There's different types of fire extinguishers. To use a fire extinguisher, remember the PASS word, or pass. P stands for pull, pulling the pin to unlock the extinguisher. A is aim at the base of the bottom of the fire and stand 6 to 10 feet away. Squeeze the lever to discharge the agent. And sweep the spray from left to right until the flames are totally extinguished. Basic first aid. Basic first aid is being able to provide basic medical care to someone who is experiencing a sudden injury or illness. It often comes in forms such as treatment to burns, cuts, or even insect stings, but could also consist of providing support to someone in the middle of a medical emergency. Everyone should have at least one first aid kit in your house and another in the car. Check each kit regularly and replace missing items as needed. Everyone should know where the first aid kit is located and how to use what's inside. Your basic first aid kit may include things such as a manual, adhesive tape, sterile gauze, adhesive bandages, elastic bandages, soap, antiseptic wipes, antibiotic creams, certain medications, tweezers, scissors, safety pins, antiseptic solutions, and hydrocortisone cream. What to do if someone is injured and bleeding? For minor bleeding, you want to rinse the wound with water to clean out any dirt, foreign objects, and debris. Use a mild soap to wash and rinse completely. Use an antiseptic to prevent infection, and cover the wound with a bandage or gauze and tape. Check the wound daily. The bandage is no longer needed once a scab has formed. Call the doctor if the area becomes swollen, tender, warm, or begins to drain pus or any other liquid, or if the area changes color to bright red, as these can be signs of infection. For major bleeding, wash the wound with water to determine how large the area is. Place a piece of gauze or a clean cloth to cover the entire area. If possible, raise the wound above the person's heart level. Apply direct pressure to the wound area with the palm of your hand for at least 5 minutes. If blood soaks through the gauze or the cloth, place another layer of gauze or cloth on top of the others. Do not remove the original gauze. Call the doctor or 911 if the bleeding continues for more than 5 minutes with pressure applied, if you're unable to clean the debris out or there is something stuck in the skin or the wound, if the wound starts to bleed again, if the wound's on a person's face or neck, if the cut is more than ½ inch long or appears to be very deep. Some deep wounds can result in further nerve damage. And if the injury or wound was caused by an animal, a burn, a human bite, electrical injury, or a puncture wound of any kind. Acute change in member status. If you notice a change in your member's health condition, it's important to notify your manager right away. For all emergencies, dial 911. Document the time the change occurred and the symptoms associated with the change. This information may be useful to emergency responders. Advance directives. Advance directives are legal documents that provide instructions for medical care and only go into effect if you cannot communicate your own wishes. A common advance directive is known as the MOST form and is kept in the member's home. The MOST form is a medical order form similar to a prescription that is signed by the physician and relays instructions between health professionals about a patient's care. The MOST form is based on an individual's right to accept or refuse medical treatment, including treatments that may extend life. Typically, this form appears on a bright pink paper and is kept on the member's fridge for easy access during an emergency. The MOST form is where you will determine whether the patient is a DNR, do not resuscitate, or a full code, perform CPR if found unresponsive without a pulse. CPR. CPR stands for cardiopulmonary resuscitation. CPR is a combination of rescue breaths, mouth-to-mouth, and chest compressions. CPR can assist to restore the circulation of oxygen-rich blood to the brain. Without oxygen, permanent brain damage or death can occur in less than 8 minutes. It is strongly recommended that you take a certified CPR course. To find a course near you, call the American Red Cross. or go to redcross.org. For CPR, first determine if CPR is needed. Only perform CPR if a person is not breathing, responsive, or circulating blood adequately. Determine if the scene is safe for you to assist the person. Evaluate if the person is responsive. Check for breathing. Instruct someone else to call 911 for help and get an AED if available. And start CPR and continue the steps until another help arrives and is willing to take over CPR at that time. Do not stop CPR once you have started. Please watch the CPR videos provided to you by HR. The Heimlich maneuver. Heimlich maneuver is the action that is performed when someone is choking. When someone is choking, it means that something is blocking their airway, preventing proper airflow in and out of their lungs. If this airflow is blocked, the brain is deprived of needed oxygen and it can become a life-threatening emergency. Someone may be choking if they gasp or wheeze, are unable to cry, make noise, or talk, grab at their throat, or wave their arms. They appear to be panicking, they're unable to breathe, and they can change color from bright red to bluish gray. If you believe someone is choking, ask them if they need your assistance and instruct somebody to call 911. Get the person to stand up. Position yourself behind the person. Lean the person forward and give 5 back blows to their back with the heel of your hand. Place your arms around their waist. Make a fist and place it just above the navel, thumb side in. Grab the fist with your other hand and push it inward and upward at the same time. Perform 5 of these abdominal thrusts. Repeat until the object is expelled and the person can breathe or cough on their own. Incident reporting. Critical incidents. The provider must immediately notify the Mass Health Agency of any of the following incidents and follow up in writing within 3 business days: the death of a member, a fire or other natural or unnatural disaster in the qualified setting or the office, a life-threatening accident or incident, a serious communicable disease contracted by the staff or a member, any allegation of abuse or neglect of or by the member, and a member missing from a qualified setting. If any of the above situations are noted, notify your program director right away. The program director will complete a critical incident report and report to Mass Health accordingly. Thank you. Please complete the post-test following the presentation and pass it into your HR or your manager when complete. Thank you for all that you do in caring for our members.